We're delighted to share the findings of our study on COVID-19 vaccination during pregnancy, coverage, and safety. Even though COVID vaccination is offered to pregnant women in the United Kingdom, there are limited data on its uptake or safety. And therefore, the main aims of the study was to establish the uptake of COVID-19 vaccination in pregnancy and its determinants, as well as safety outcomes. This was a cohort study of pregnant women who gave birth at St. George's Hospital in London between March 1st and July 14th, 2021. Data were collected on whether they received 1 or 2 doses of the COVID-19 vaccines during pregnancy, the type of the vaccine they received, the gestational age of vaccination, maternal characteristics, including maternal age, parity, ethnicity, index of multiple deprivation score, and comorbidities, as well as pregnancy outcomes. The main study outcomes was the uptake and its determinants, as well as safety outcomes. And the outcomes included stillbirths defined as fetal deaths at 24 weeks or beyond, neonatal deaths, gestational age at birth, preterm births less than 37 weeks, fetal abnormalities, birth weight, intrapartum complications, which included intrapartum pyrexia, suspected chorioamnitis, placental abruption, and postpartum hemorrhage. It also included mode of birth, maternal admission to high dependence unit or intensive care unit, and admission to the neonatal unit. We used propensity score matching to compare the pregnancy outcomes between those who received at least 1 dose of the vaccine and those who did not receive any vaccines. And we used logistic regression analysis to determine the factors associated with vaccine uptake. In this period, 1,815 women gave birth, and we had data on 1,328 women. The vaccine uptake was 28.7%. Of those who received the vaccines, 86% were in the 3rd trimester, 14% in the 2nd trimester, and none in the 1st trimester. And the 91% received the mRNA vaccine, that was Pfizer or Moderna, while 9% received the viral vector vaccine, which was AstraZeneca. When we used a univariable logistic regression analysis, we found that younger maternal age, high level of deprivation in Afro-Caribbean ethnic background were associated with lower vaccine uptake, while history of pre-pregnancy diabetes was significantly associated with higher vaccine uptake. When we used multivariable regression analysis, the high level of deprivation and the history of diabetes remained to be significantly associated with vaccine uptake. When we compared the outcomes, there were no significant differences in any of the pregnancy outcomes between those who received at least 1 dose of the vaccine and those who didn't. We also found that the vaccination was not significantly associated with gestational age of delivery prior to 40 weeks gestation. So in conclusions, of pregnant women eligible for COVID-19 vaccination, less than 1/3 actually received the vaccine, and they experienced similar pregnancy outcomes to those who did not receive the vaccine. We found lower vaccine uptake among younger women, those of Afro-Caribbean racial background, and those with high level of deprivation. This study contributes to the body of evidence that having COVID vaccine in pregnancy does not alter perinatal outcomes. Clear communication to improve awareness among pregnant women and healthcare professionals on vaccine safety is needed, alongside strategies to address vaccine hesitancy. This includes post-vaccination surveillance to gather further data on pregnancy outcomes, particularly after 1st trimester vaccination, as well as long-term infant follow-up. Thank you for your attention, and I hope you enjoy reading the article.